Hello everyone. Hi, this is me, Jansi Mehri, tutor working at Triple M College of Nursing. Today we are going to discuss about the topic oxygen mask. So let's dive into the topic objectives. At the end of the session, the listeners will be able to define oxygen mask, parts of the mask, indication, purposes, how to use articles, procedure, complications, and also about the nurse's responsibility. Introduction. Oxygen is administered as a corrective treatment for conditions resulting in a hypoxia. It covers the nose, mouth, and sometimes the entire face, and it is connected to the oxygen supply system via a tubing. Oxygen masks are widely used in healthcare settings such as hospitals, emergency services, and also at home care. Definition. An oxygen mask is a medical device used to deliver oxygen from a storage tank or concentrator to a patient who requires supplemental oxygen. So oxygen therapy is administration of oxygen concentration greater than the room air with goal of treating or preventing the symptoms and manifestations of hypoxia. What are the parts of the mask? Okay, so as I told you, it covers the mask, nose and the mouth. There is a non-adjustable nose clip. This is a mask as entire, and we have an exhalation port. This is a string. We have an oxygen inlet. This is the mask joint where the connector is connected, and there is an air tube or a connector, and there is a joint as well, air tube joint as well. So these are the parts of the mask. Indications. So when it is indicated, when the patient is breathless, obstructed airway, when the patient is having cyanosis, when he or she is having shock or circulatory failure, anemia after severe hemorrhage, asphyxia, and carbon monoxide poisoning, post-operative chest surgeries, or air hunger. Purposes: to supply oxygen in concentrations where there is interference with normal blood oxygenation, to reduce the effect of anoxemia, and to maintain healthy level in tissue oxygenation. How to use it? It delivers approximately 40% to 60% of oxygen at the flow rate of 5 to 10 liter per minute. Uses for patients needing moderate oxygen supplementation and limitations. Uh, it can cause discomfort during extended use. So must be removed for eating and drinking if the patient is comfortable. And this is oxygen cylinder. This is a kit. These are tanks. And this is a spanner with spindle and key. Okay, so this is an oxygen stand. These are the parts of the oxygen cylinder. So what are the parts of flow meter then? So this is a flow meter where we have the readings, and this is an oxygen pressure gauge, and this is oxygen pressure gauge where it has safety valve in it and pressure reducing valve body, and there is an adjustment bottom. This is a knob where we can adjust, and there is a moisture bottle. Now the moisture bottle, we are not filling it with water, it's a plain dry oxygen we administer for the patient. So this is the parts of flow meter. Okay, next this is a cylinder. So here a wheel type knob or valve is there with an adapter. This is a cylinder. This is the bottom of the cylinder, and we have a cannula connected. And this is a humidifier bottle, as I told you. Outlet is there, and also flow adjustment regulator. So this is an oxygen cylinder. So oxygen supply articles required are a flow meter, humidifier with a sterile distilled water, and mask and tubing. So these are the articles required. Steps for maintaining. So prepare the oxygen source first, connect the tubing, then position the mask, adjust the flow rate, monitor, and then maintain hygiene. So we'll see a quick video of how could we do that. Okay. So as a nurse, we must be aware. We have to see and check for the doctor's order. Once the doctor's order is prescribed, then take a port as I told you, adjust the cylinder, connect to the connecting source. Okay, here we had given with water. Nowadays it is administered with dry oxygen as well. Okay, so That's nothing but the humidifier. And now the mask is being connected to the patient. Okay, adjust the strings. Once the strings are adjusted, make sure it is snugly fitted. Then look at the eye level and connect the oxygen source as advised. So 10 liters is advised and that has been administered. So this is about the procedure of oxygen mask. Okay, what are the complications? Maintain hygiene as I told you earlier. Now we'll see what is complications. Oxygen toxicity, depression of ventilation, retinopathy, absorption of atelectasis, fire hazard and infection are the complications. Okay, as nurses, what are the nurses' responsibility? Assess oxygen saturation levels, monitor the patient respiratory status, check the oxygen flow rate, ensure proper fit of the mask, humidify the oxygen, or nowadays it's given without humidification. Monitor for oxygen. As per the hospital policy, we can give the humidified oxygen or dry oxygen. Monitor for oxygen toxicity, oral and skin care, encourage deep breathing and coughing exercise, ensure patient safety, educate the patient and the family regarding the same, and document the care what you had provided. Hope you understood. Thank you.